Good afternoon. My name is Vince Rock, Program Manager here at the American Brain Tumor Association. The ABTA is pleased to welcome you back to our webinar series. Today's webinar will discuss unemployment and disability. Please note that all lines during our webinar today are muted. If you have a question you would like to ask, please type and submit it using the question box in the control panel on the right-hand side of your screen. Our presenter will answer questions at the end of the presentation. The webinar will be recorded and posted to the ABTA website within the next week. Registered participants will receive the webinar recording in a link follow-up email message within the next week. In the next few days, you will receive an email asking you to take a brief survey to evaluate the webinar. Please take a few minutes to share your feedback, which is important to us as we plan for future webinars. I am delighted to introduce our speaker today. Roslyn Turner, LCSW, is an oncology social worker at the Kellogg Cancer Center at NorthShore University Health Systems, located on the north side of Chicago. She graduated with a BA in Communications from Lake Forest College and received her master's in social work from Loyola University Chicago. Roslyn has spent her entire social work career in oncology, helping patients navigate the many difficult practical concerns that arise with any diagnosis and providing ongoing emotional support and resources. Thank you for joining us, Roslyn. You may now begin your presentation.
Great, thank you so much for having me, and thank you everybody for tuning in today. As stated, we'll be discussing unemployment and disability and really navigating the what's and how's of accessing resources available to you, and just really where to go after a brain tumor diagnosis. So before we begin, I'd just like to say that I have no employment with any company, no consulting or agreements, and no clinical trial support from any companies. So I'd like to begin with the diagnosis. You have a brain tumor. Now what? Many questions arise. Work or not work? If I do work, what are my rights? What are the benefits available to me from my employer? If I do or don't work, what will my insurance be? And also, where will I be getting my insurance from? So I think it's important to begin with the Americans with Disabilities Act, ADA rights. And this was a law passed by Congress in 1990 that essentially made it against the law to discriminate against any qualified person with a disability. The ADA protects people with disabilities in all areas of life, most importantly, including their employment. So the ADA defines disability as having a physical or mental impairment. This is illness, injury, or a condition that substantially limits your ability to do major life activities, and having a record of such impairment or having regarded as such impairment. And so this includes a cancer diagnosis. Now, the ADA rights apply to employers that have 15 or more employees, and it protects the employees really in all aspects of the employment. So that's in the recruitment process, interviewing, hiring, once you're working there, and additional benefits you receive while you're an employee of this company. So in the workplace, people with a defined disability are able to access what's called reasonable accommodations in the workplace. And it's any change to the process or the way the job is done, the environment in which you're doing your job. And they have to be considered reasonable, meaning that they do not create any undue hardship or direct threat to the employer. So many examples of what could be considered a reasonable accommodation to you if you were to consider continuing to work after your diagnosis would be finding out if you're able to work from home, finding out if you can flex your time to make doctor's appointments or treatments or whatnot, having special equipment like a stand-up desk or a special kind of chair, being able to have a service animal at your work, being able to have a closer parking spot so that you don't have to park as far away from the door, from your office. Things like this is what would be considered a reasonable accommodations through the ADA. And what's great is that the ABTA has a wonderful returning to work after diagnosis pamphlet that you can check out that could really go more into depth about the rights that you have and how else that you are protected under the Americans with Disability Act. Now, aside from the ADA, there is also the Family and Medical Leave Act, more commonly known as FMLA. FMLA is for employers that have 50 or more workers, and it allows employees to take up to 12 weeks of unpaid job protected leave. Now, this leave can be used continuously or intermittently. So for example, when you're first diagnosed and you may need to have a surgery and you may need to be out for 3 to 4 weeks, you can apply for FMLA and take that continuous leave for that 3 to 4 weeks. But if after that time you're able to return to work for whatever, but may need to take some time off to go to a doctor's appointment or just because you're on a treatment that may make you feel sick a certain day, then you're able to use that leave intermittently. Well, you'll be working and those days off that you have can be these unpaid job protected days. Now, you and or your employer may require a request that any PTO, vacation, or sick time you have be used concurrently during these leaves. So it's really important to find out from your company's HR department, what their specific policy is in terms of accessing your FMLA and what the rules are using your PTO, vacation, and sick time around that. Now, for companies who do offer you a short-term disability benefit, this can be used during your FMLA. So if you're able to be paid a certain percentage of your pay during time you're taking off, you will then have the job protected leave through the FMLA and have income through your short-term disability. Because otherwise, again, FMLA does not offer any pay, only the job protected leave. Now, FMLA can be used for your own illness. So the patient who's diagnosed can take it for any surgeries, any treatment, any doctor's appointments, just not feeling well. But leave can also be taken to care for someone. So you have to be a qualifying family member under the FMLA that is including a spouse, a domestic child, caring for your parent, partner, or your child. And while you're on FMLA, your employer must keep you on their medical insurance plan, but you may be asked to pay the premium because since you will not be receiving pay, as it's, again, only job protected unpaid leave, you may be asked to then reimburse the company for the premium of the insurance. But again, this is something you should check with your HR department because every company has different benefits that they offer their employees. So to qualify, you must have worked for at least 1 year for that employer and worked at least 1,250 hours during the past 12 months. So this is very important if you're thinking of taking FMLA to really talk with your manager, your HR, whoever is in charge, your director, to find out that you actually qualify to receive this benefit. So what you will have to do is get an FMLA application and inform your employer of the health issue and why you cannot work. And while employers are entitled to medical certification from your medical doctor of that you cannot work, they cannot request your medical records and you do not need to disclose your actual diagnosis. You just need to prove and show why it is you cannot be doing the job you're doing and need to take whatever time off it is you need. So again, for more information, please turn to the American Brain Tumor Association's quick guide of the FMLA, Family and Medical Leave Act, which I think would be a big help for understanding this even more. So as I previously mentioned, short-term disability. Short-term disability is different from employer to employer. Some offer it automatically once you accept your employment there and start and your benefits begin. This could be a covered benefit you have or when you are electing your benefits when you first join the company, you may have to elect short-term disability. It could possibly be free of charge to you, or there may be some monthly fee that is taken out of your paycheck to cover short-term disability benefits in the event of you may need it. Usually short-term disability pays you a percentage of your salary for a certain amount of time. To find out exactly if you have short-term disability benefits or what your short-term disability benefits may be, again, I always recommend contacting your manager, your director, going to your HR department, or looking in your employee company handbook, which you're usually sent or given, or could be on an internal computer drive, to really learn of how your specific company works. Now, short-term disability is not a government benefit offering. There are only 5 states in the United States to be known of having some type of short-term disability program, and that's California, New York, New Jersey, Hawaii, and Rhode Island. So if you reside in one of these states, I suggest you go either through your Department of Human Services or your Social Security administration office to see what those specific benefits are and how you would access them. So differently from short-term disability is long-term disability. This again is different from each employer, and it's either, this is more commonly offered automatically compared to short-term disability, but again, every company is different. This may be a benefit you would have had to elect, you may have to pay something for it, or it may just be offered to you if something were to happen while you were employed. This again pays you a percentage of your salary based on your specific employer benefits. Some amounts could change based on your years of service with the company. So as I've been saying over and over, your manager, your director, your HR department, or any employee or company handbook are really great resources to turn to understand how you access any long-term disability resources and benefits you may have from your work. Some employer plans offer you long-term disability along with a stipulation of applying for Social Security disability insurance, which is run through the government and will be highlighted later in this webinar. Others may require you to apply for SSDI if you're going on long-term disability from your company, and may pay you the difference based on if you get approved for Social Security disability insurance, or may stop once you receive that. So we'll discuss it a little bit later, but long-term disability and short-term disability insurance may go hand in hand, again, depending on how your company defines it in their specific benefit package to you. So I've said this a couple times now, Social Security Disability Insurance, SSDI. What is this? SSDI is a government benefit. The Social Security pays benefits to people who can't work because they have a medical condition that's expected to last at least 1 year or result in death. And this definition is very important because if someone has a diagnosis, but all their medical records and their medical team is stating that kind of one's going through treatment, there's a good chance that they can return back to baseline or whatnot. It may be more difficult to then qualify for SSDI because your medical condition may not last 1 year or result in death as defined by SSA.gov. So it's very important to really understand your diagnosis, talking to your medical team about what your prognosis is, what this looks like, what they could help you in terms of making a decision to apply for SSDI or not. So again, like anything, there are certain qualifiers to receiving SSDI benefits. You must have worked a certain amount of years based on your age. And there's a really great chart on the SSA.gov when you're going on SSA.gov, looking at filing for disability. All of these resources are listed there. But basically, for example, if you became disabled at age 50, then you generally would have needed to work for at least 7 years. So there's a chart that will show you at your age when you get your diagnosis, if you have the work history to qualify for this benefit. And there's two great ways to apply. SSA.gov has the application right there. So you can create an account for yourself, start the application. You can call and receive an application sent to your house. But with both of these, you're going to end up receiving an interview from one of the Social Security Administration representatives. So that's just the two best ways to start. And they ask for a lot of information, which I've covered here. But basically, in summary, when you're thinking of applying, it's very important to kind of get these things together. And also on SSA.gov is a really great checklist that could be a visual to help you prepare for this. So you need birth and citizen information, any marriage information you may have, names and birth dates of your children, if you ever served in the military, your current and past 2 years information of your employment, your banking information, and this is important because if you are approved, they automatically put in your direct deposit. They used to send checks out monthly, but they've really switched to a direct deposit just for security and safety. So that's why they ask for banking information. They will also ask you for contact information for someone who knows about your medical condition. So this could be a social worker at the medical office or hospital that you're treated at, a nurse of your doctor that you work closely with. But there is a medical release form that's important to get this signed so that the Social Security Administration knows they could speak with your medical team. They'll also ask you for a lot of medical information. So your medical conditions, the reason why you are applying for disability, your doctor's information, any medications you're on, medical records like progress notes, possibly pathology notes. They will also ask for your job history and any education and training you have. So I know that seems like a lot, but if you're able to visit SSA.gov, there's a very clear checklist that can help you stay very organized with this. So processing an application can take anywhere from 3 to 5 months. Now, expedited applications are looked at on a case-by-case basis and based on severity and if it is a terminal illness. That's what's called compassionate allowance for expedited consideration. And the diagnosis listed, glioblastoma, anaplastic astrocytoma, the glioma, CNS lymphoma, metastatic melanoma, these diagnoses listed here can help expedite your application to be considered sooner. However, for anyone applying, whether it's expedited or a regular application, once approved, there is a 5-month waiting period for your benefits to begin. So meaning if you are approved as of April, you won't actually be receiving your payments, your SSDI benefits, until 5 months after that date. Your payments can be retroactive up to 12 months, but excluding the waiting period for your application to be approved. And another benefit of being approved for SSDI is that after 2 years of receiving the benefits, meaning not from the date that you were approved for SSDI, but from the date you started receiving your benefits, that 5-month waiting period after the approval, you are eligible to receive Medicare. So that would then be insurance coverage for you. So that brings us to insurance options. There are 3 types of ways to obtain insurance. Through your employer, so that's any commercial plan, Blue Cross Blue Shield, Aetna, United Health, whatever your employer is providing you and your family commercially. There is COBRA, the Consolidated Omnibus Budget Reconciliation Act, which we will go over shortly. And then after your employer, there's marketplace plans. So this would be the Affordable Care Act, Obamacare, those types of terms which you may have heard, accessing the marketplace to receive an insurance plan, which each medical facility accepts different types of marketplace plans. So if going to the marketplace is something that you are considering because you're either self-employed or you no longer have an employer to offer you commercial or COBRA, it's important to talk with your medical facilities to understand what plans they accept so that you don't enroll in a plan that your doctor no longer takes. And then aside from your employer and aside from the marketplace, there are two types of ways to get insurance through the government, and that is Medicare and Medicaid, which we will discuss shortly. So COBRA, as I mentioned, the Consolidated Omnibus Budget Reconciliation Act. This was passed by Congress in 1985 to allow for continued healthcare insurance for a period of time after losing your group coverage. And this is either to leave of employment or because of termination of employment. So COBRA allows individuals to maintain their coverage for up to 18 months after said termination or leave. Now you may have heard, oh, but this person got this amount of time or this person got this amount of time. It's on average 18 months after you are terminated or after you choose to leave. There are some situations where you do get 36 months of coverage, but this is if the employee themselves passed away and their spouse was needing to be covered, and they would get 36 months. If there were any divorce or legal separations issue, or when enrolling in Medicare. So it's important to know from your employer exactly what their COBRA benefit offer to you is. Once a termination or a leave of employment happens, the employer has 14 days to send the employee their specific COBRA information, and the employee has 60 days from the date of termination or date of leave to decide whether or not you want to enroll in COBRA. And if anything is to happen in those 60 days, most usually it will be covered under the COBRA coverage that you would be receiving. Usually COBRA has higher premium amounts because it's no longer being subsidized by your employer. But again, every employer has different benefits. So this is where I'll go back and say it again, check with your manager, director, your HR department about your COBRA specific benefits. So now we're going to go to the government sponsored insurance plans. First, we have Medicare. Medicare is a national health insurance program run by the government. Eligible individuals are those who are 65 years in age or older. If you have end-stage renal disease, ESRD, or ALS, Lou Gehrig's disease, and if you have been receiving, as I mentioned before, Social Security Disability Insurance Benefits, SSDI, for 2 or more years. And the way Medicare works is in these different parts. You'll hear people talk about Part A, Part B, Part D. So I'm going to break it down for you. Medicare Part A is your hospital insurance. So there is not a monthly premium for most people for this, and it covers if you were to have to go to the hospital and be admitted emergently or for a planned surgery. Your Part A would cover those services. Medicare Part B is your medical insurance. So this is any outpatient visits you may have going to an oncologist or a specialist of some sort. This does have specific premium and deductible cost, which range year to year, different plans you're looking at. Medicare Part D is for your prescription drugs. So I know this is a little bit different than, when you're turning 65, it's different than typical commercial insurance you've had. It is very important to enroll in a Part D plan to make sure that you have your medications covered. There is an annual deductible that goes with Part D plans, and there are different ones. So it's important to look at the plans, see what medications you're on. And I know for some people who I've heard many patients say, well, I'm not on medications, I'm completely fine. It is important having that because you never know what may pop up and change your situation, and not having that D coverage can then make you have to pay for those medications out of pocket, which can be very, very costly. So if you can, talk to a social worker or a financial advocate counselor that's at your medical facility. If you're thinking, if the opportunity has arisen for you to go into Medicare or you're aging into doing Medicare, and kind of getting that Part D plan ahead of time. Then there's Medicare Part C, and Part C is referred to as Medicare Advantage plans. So these are plans that kind of roll your Medicare A, B, and D into one, and it's managed. So it's a managed care plan, which means you have all of those benefits, and sometimes they offer you additional benefits that you don't have with regular Medicare, like some vision and dental. However, you have much less provider choices. So if you're thinking that this is a route for you and you want to go into a managed plan because of the benefits you're hearing, I strongly urge you to talk to the providers you already have or providers you think you may be needing to go to because of your diagnosis, and find out if they accept this Advantage plan, because there are less options for you. So just be sure that whatever you're deciding to go to, you do your research on what will cover the diagnosis you have, medications you're on, physicians you like seeing, to make sure that you'll have the right coverage. Now, differently from Medicare is Medicaid. Medicaid is also a government national program, but it is means tested, that is jointly funded by the state and federal governments and managed by the states. So to be eligible, generally open to low-income adults and their children and individuals with disability. You must be a U.S. citizen or a qualified non-citizen to be eligible for Medicaid, and it is income and asset based. So I always encourage that you check with your specific state, because they are all different in how their Medicaid plans work. Medicaid, the levels to qualify for Medicaid change annually and is dependent on household size or disability and other factors that'll play a role to see if you qualify for Medicaid. Now, some states have expanded Medicaid coverage, meaning that you would qualify based on your income alone, and doesn't also take into consideration your household size and assets and things like that with regular Medicaid. So we have listed a great website here, healthinsurance.org/Medicaid, that you can check to see if your state has expanded its Medicaid coverage and would maybe make you eligible where you originally thought you wouldn't be. The application waiting times to receive your Medicaid do vary by state. So again, this is something where I encourage patients to go to your local Department of Human Services, DHS office, to apply and get more information for, because it is very different from state to state. So now that we've kind of gone over the insurance and employment income side of once you have a diagnosis, I think it's really important for patients to understand that there are a ton of other supportive services available to them. And sometimes they're readily out there and you could hear, but if not, you may need to ask about them. So first and foremost, connect with a social worker at your specific medical facility, because they'll know a lot of these things that I'll mention as well, but they might know of even more specific resources for your area. There are a lot of community, city, state resources that are unique to those areas that one person couldn't all know. So the social worker is really a wealth of knowledge. Where you are, there may be different wellness centers. For instance, a cancer support community, a Gilda's club. These are places dedicated to helping benefit the wellness of patients having a diagnosis, and have many different services like therapy or wellness like meditation or massage or support groups. So really find out if you live in a place that has a local wellness center. Dietary and nutrition services are obviously very important once you have a diagnosis. So at your medical facility, there may be a dietitian available for you. There may be services like Meals on Wheels. So in your community, if you're having a hard time having access to food, you can get food delivered. So definitely ask about what's available to you. As briefly mentioned before, certain qualifying medical conditions allow you to access a service animal. And this could be having mobility problems or seizures or neurological problems, epilepsy, balance and dizziness. So your medical facility should be able to know if you help to see if you would qualify for a service animal, if it would be something that would really benefit you, and how to access that. So other things, when you have a diagnosis, you may be going to treatment a lot. It may be difficult for you or a family member to drive. There's different types of transportation assistance, things offered through the American Cancer Society, local community centers, other state or city transportation options for you. So definitely ask about that. Cleaning services in your home. If you need in-home caregiving. So depending again on your income and if you qualify for Medicaid, different areas of the country have in-home, what we call caregiving or homemakers, could be a benefit if you do qualify for Medicaid, but on a larger scale, in-home caregiving is usually a private pay option, but there are many around where you may live and you can find out what their fees are, how they work, kind of look at them. And then durable medical equipment. Many people don't know that walkers and wheelchairs are things that are covered by insurance, as well as some other things for your home. So before kind of going out and buying it, talking with your medical team, your social worker, to find out what benefits you may have through your insurance and or your hospital that would allow you to access this durable medical equipment. So I like to leave with some resources. Cancer and Careers does a wonderful job giving education about working while having a cancer diagnosis, as well as triage cancer and any legal issues that may impact those diagnosed and their families. So please feel free to check out these websites. And as I've listed in the presentation, great resources and more information for the Social Security at ssa.gov, and Medicare and Medicaid each have their websites. So I would just like to thank you all for listening and tuning in today, and I hope that this gives you some good information and things to help you with your journeys.
Thank you, Roslyn. We will now take questions. If you have a question you would like to ask, please type and submit it using the question box in the webinar control panel on the right-hand side of your screen. We will answer questions as time allows. So Roslyn, our first question is about returning to work after a disability. Do you have any tips or suggestions for someone in that type of situation?
Returning to work, yes. So I believe, let me kind of go back here. I want to turn again to the ABTA's access guide on returning to work. I think it's just important in understanding the rights that you have, any reasonable accommodations you may need when going back to work. Just knowing that there's a lot of support for you, and knowing that what you can and can't handle, and just being organized and prepared for it to kind of help with anything that may pop up will kind of help in that success of returning back to work.
Thank you. You were speaking at the end of your presentation about Medicare, and a question came in: is Medicare disability coverage means-based?
No, Medicare is not means-based. Medicare, again, is the government option where, let me get to it, you either are 65 or older, you have end-stage renal disease or ALS, or you have been receiving Social Security disability for at least 2 years. So this is not means-based. You don't need, it does not matter on your income or asset. It just matters that you either age into having Medicare, or if you've been considered disabled and receiving benefits for 2 years, then you would be able to access it. So this is not a means-based coverage from the government.
Thank you. If somebody is reviewing their disability status, what suggestions do you have so that they can prepare for that review? What should they expect? What should they expect to say during that review process?
Absolutely. So again, I'm going to go back to getting prepared to apply for Social Security disability, and the ultimate interview you have is just really making sure you have all the information, because this is a lot of times where things get held up. You didn't provide correct employment information, or you didn't provide correct citizenship information, or there wasn't enough medical information. So I think this is a very brief list, but again, before you start your application, either calling for it on the phone or online, visit ssa.gov. There are booklets about applying for disability and what to expect. There are checklists that you could really go through and make sure you have everything. Make sure you've signed the medical release for the Social Security Administration to contact your medical doctor, your facility, if need be, so that they can really have all the records they need and all the information, so that why you're applying and that you qualify and that you have everything isn't missing. So I think that getting ready to have that reviewed, applying for that, just being organized and getting all of this information ahead of time really helps out with getting that approved in a quicker manner.
Thank you. And our last question for today, there are some people who, when they apply for Social Security disability, are denied coverage. Do you have any suggestions for people who may want to appeal that decision or reapply at a later time?
Yes. So I want to tell you all, it is not uncommon to get denied at the first application try. They are receiving lots of applications. They're trying to go through it with a fine-tooth comb. And it's really an initial denial happens usually because there's either you just do not qualify, you do not have a medical condition that's expected to last at least 1 year or result in death, or it's that you don't have the supporting documentations. So when you're going to apply, really make sure that you qualify based on their definition of disability and having everything organized and having everything. When you receive a denial, pay very close attention to any paperwork that you're receiving from the Social Security Administration. They send letters with very specific dates that you have to appeal by, who you have to contact, who your adjuster would be. So making initial contact, letting them know you received it, letting them know you're interested in applying, and just being on top of that, because a lot of people run out of their ability to apply just because they've missed the deadline. If you've been denied and you would like to reapply, there's different ways you can do it. You can look through the documentation, find out exactly why it is they're denying you, either something's missing or whatnot, and try to gather that to get it for them. Or there are specific organizations and specific lawyers who are SSDI attorneys, who this is what they focus on, this is what they do. And they all have the same kind of fee structure, different in the state or city where you may be living. So again, it's something you could either research, you could go to your community legal center, you can ask your social worker if they know of attorneys or organizations that help people reapply or appeal a denial decision. And these professionals, while they do take some of your back pay, really help kind of guide it when, the legal system can be very confusing for all of us, and can just be a really great support to help you do this while you're focusing on other important things that are going on, like diagnosis and treatment and being with your family.
That is all the time we have today. Thank you all for joining us. And thanks once again to Roslyn Turner for her wonderful webinar presentation. Aside from our educational webinar series, the ABTA has a variety of programs that help support patients and caregivers throughout their experience. The ABTA's Breakthrough for Brain Tumors 5K run and walks currently take place in 10 cities throughout the United States. We are gearing up for our fall events and would love to see you there. Learn more by visiting bt5k.org. And for more information about ABTA's programs, events, and services, visit our website at abta.org, email us at info@abta.org, or call the ABTA Care Line at 800-886-2282. This concludes our webinar. Thank you for joining us, and please be sure to complete the evaluation survey you will receive by email within the next few days. You may now disconnect.